I'm a physician. I am board certified in internal medicine and rheumatology. I have a doctorate in immunology. I did a postdoctoral fellowship at Harvard University when I came here in the United States. I followed that with a transplant immunology fellowship at the University of Pittsburgh. And then I graduated 5 years later from University of Cincinnati, where I did my rheumatology fellowship. Just a few things about me. When I grew up in Romania. I was exposed to a culture that I thought that's the culture that everybody has. But when I came here in the United States and I started to see patients, I realized that actually a lot of patients will have very different cultural approach when it comes to nutrition or the things that they do in life. So seeing patients struggling and myself going through a period of struggle with some symptoms that were not clear to me. Some were fatigue, extreme fatigue, and also I was also having joint pain. I started to think, what can I do to change the outcome for myself, but also for my patients? Some of my patients were feeling great after starting treatment for their arthritis, but some were lagging behind. And I wanted to understand, what is the difference? How will I make them feel better? How will I improve their quality of life? So I started to invest in myself and invest in my knowledge. So I pursue a nutrition science course from Stanford, followed by a mindfulness course from University of Massachusetts. And I started to understand how important it is to implement those in the life of my patients. But besides all these degrees, I want to tell you that I'm a mother of 3 kids. I'm a wife. I'm a sister. I'm a daughter, and I'm also a patient. So to begin this lecture, I know that many of you will experience pain. I know that some of you, because of pain, you will feel very frustrated. You will feel very depressed about what's going on. You don't feel like, waking up in the morning is hard. You start feeling stiffness, joint pain. Some patients will have severe back pain, and all of this will have a huge impact on your life. Most of the patients will tell me, I go to see a doctor, another doctor, and another doctor, and all the things that they will offer me is another medication. And that's very frustrating because I've been there. I know how it is. I was researching for my own health, and every single lab that I had was normal. So I went to see the physician, another physician, of course, and myself being a physician, they did not have an answer for me. And as I said, I started to research myself, the things that I thought will help me. And I tried to actually, let's see, why is this not working? I tried to actually find, an answer for me. And also, while talking to patients, I had thousands of patients that I treated. I realized that they own their own story. They have a story, and those patients that were feeling actually better had the power to tell me what they were doing differently. And in time, I started to realize, and I started to introduce this idea of food as medicine. You probably know that what you eat is what you are, but I would like to reinforce that. And when you look at food, it shouldn't be about just what you eat. It should be about an experience that you have with your family, an experience that you have with your friends. It should be something that will fulfill you, and it shouldn't be a chore for us. When I talk to people, they all ask me, what is the best diet? And when I hear this term diet, the thing that comes to my mind, it's a very restrictive plan. And I will tell you that, from patients and from myself, diets are very hard to keep. Diets are not sustainable. Diets are not something that will change your quality of life. When you hear the term diet, you're going to think it's something restrictive that will impact your life negatively. So I know that probably many of you research the topics on internet, and you actually, found tons of resources. People are talking about the benefits of paleo diet, Mediterranean diet, keto diet. You see pyramids, you see food plates, you see blogs. But unfortunately, all of those things, will not bring a lot of clarity or will bring a lot of confusion. Patients will ask me, what is best? Fat, no fat, carbs, no carbs, which plan is good? The Weight Watchers, the cabbage diet, you name it. They will ask me about all of that. And I think that, the way that you should approach it, you should understand that, your diet, it's going to impact your whole health. And there is a great connection actually between our brain, our gut, and our arthritis. And I start with this diagram. I present this diagram to a lot of patients because they will ask me, so what is the relationship between what I eat and how I feel? And I tell them it's a huge relationship. And, just in a nutshell, I will explain to you, but I think that probably most of you will have an idea what I'm going to talk about. When you start approaching a diet, or when you start talking about nutrition, you should know that that will impact our gut microbiome. And in the last 20 years, there was huge research done about the importance of our microbiome. You like it or not, we do live with about 10 trillion of bacteria in our gut. And all of these bacteria will influence how you feel, will influence our brain. And there is a huge connection between our brain and our gut, and of course, about arthritis. And there are tons of studies. I have went through a huge amount of them. PubMed is my resource. I start there and then I deep dive into the content of these researchers. And I realized that, research showed, if you didn't know, or if we didn't know, that our lifestyle choices will actually influence our health. So if you drink a lot, if you sleep less, if you watch TV a lot and you don't exercise anything, or you don't move too much, that will influence your health. Probably we all know that, but the research actually showed that there is a huge connection about these lifestyle changes or this lifestyle approach and, overweight, obesity. And I'm sure obesity is such an epidemic in our days. And, we most of the time correlate obesity with diabetes or heart diseases, but you have to know that obesity was actually correlated with cancer, obstructive sleep apnea, and with arthritis and psoriasis. People that are overweight or obese, they put a lot of pressure on their joints. They create obesity itself, creates a huge amount of inflammation into your body. And that will cause, the downstream will be all of these diseases, which are chronic diseases. Obesity also causes depression. And of course, that's not going to help pain, actually. I'm going to give you just a short example, a small example of one of the studies that was published recently in 2019 that show that people that eat ultra-processed food, they're going to change their fat mass in just 2 weeks. They're going to gain 0.5 kilogram, just 2 weeks. It took for the weight to change if you eat such things. So, of course, you're going to ask me, where should I start? And I tell that to my patients, and I'm going to tell that to you. You should start in your own pantry. You should go in your pantry, open the doors, and just look what you're going to see. And if you see sugar, you should eliminate sugar for the very first time. You should look there and you should eliminate everything that contains sugar. As you probably know, sugar, it's a powerful, very powerful inflammatory food. In this century, we eat probably more sugar than we ate in the whole history of humanity. And the processed food that we have access, it's everywhere. You should avoid that. The processed food, all the meats, all the burgers, not only that it's going to make you increase weight, but that will translate later on in heart diseases and many times autoimmunity. It does contain a lot of things that you should avoid, like sugars or saturated fats. It contains an excessive amount of omega-6 fatty acids, excessive salt, which will affect your immune system. And all of those things, not only that they don't make you feel well, and you're going to feel very fatigued after you eat such food, but it will impact your gut microbiome. Oils, when you pick up oils, you should be extremely careful. There are many bad oils. The seed oils are extremely powerful, creating inflammation into your body. Although some seed oil are good, and I'm going to point out later which ones are good, most of the oils that we buy, like corn oil or let's say sunflower oil, when you fry them, all the good things that were there, if they are good things, they will transform into trans fats. And even if you use them raw, the fatty acids ratio between the omega-6 and omega-3 is 20:1 when it should be 2:1. So just a couple of things that I tell my patients to start avoiding will be the sugar, the processed food, the trans fats. And I will add here excessive alcohol and smoking. And why I insist on that, especially on smoking, even after you stop smoking, 20 years after, your risk of developing an inflammatory arthritis, including rheumatoid arthritis, is still high. So what should you eat? What are the anti-inflammatory foods? And we're going to dive further into that. You probably heard about the leafy greens. Things like spinach, kale, broccoli, asparagus are extremely, extremely important to be added to your diet because they do contain a lot of vitamins, especially vitamin C, that will modulate your immune system. Vegetables and fruits should be the base of your plate. And, things like berries, all the berries in the world, you should incorporate that into your diet. They will bring you a lot of antioxidants and they will make you feel better. Enzymatic fruits are extremely important, like papaya or pineapple or mango. Those are extremely good for your health and they will decrease your inflammation. In terms of legumes are the basis of the Mediterranean diet. You should incorporate beans into your diet and also lentils. Those are extremely valuable because they not only bring you a lot of fibers, and your bacteria, your gut microbacteria will love the fibers, but they will also bring you a lot of vitamins and a lot of other micronutrients. I mean, I don't like the fact that people think that meat is, detrimental to your health. In reality, it's not, but the good quality meat should be incorporated into your plan. And I would like to draw attention towards fish. I tell my patients at least twice a week, they should have fish and they should have wild caught fish. When it comes to grains, I think I figured out how to do this presentation to move forward. I tell people to incorporate whole grains. And when they ask me, what are the whole grains? I start by explaining them. It's very important to understand that the whole grain, has a specific composition. It's a 3-layer composition. On the outside, you have the bran, which is the fiber-filled layer, and also contains vitamins, especially B vitamins, which are very important to our health, and a lot of minerals like like magnesium or copper. On the inside, they have the endosperm, which is the starchy carbohydrate part, and then the germ, which is the part where the grain grows. But when the process of, refining those grains happens, that process to make the fluffy flour that we see on the shelves that stays there for months and months, they remove all these layers, all the outer layers. So what we have, or what is remaining, is just the refined grain, just the endosperm, which is the part with the starchy carbohydrates. And that is the part that is causing the problem. That is the part that does not contain the fibers. So it's important for you to choose whole grains and to look on the packages about 4 grains. If you are like me, I love nuts. If you don't have any allergies to nuts, you should make nuts a big part of your nutrition plan. And the reason is that there were very important studies that they show that eating about 30 grams of nuts every day over a period of 5 years will decrease your cardiovascular risk with 30%. 30% is huge in medicine. You should use spices, a lot of spices for your food, because spices will not only bring the flavor of your food, but will also help you to prevent certain diseases. And I'm going to talk more about those in another lecture because I think it's extremely important to know about the benefits of spices. All right. The next thing that I would like you to know, and I tell my patients, is about fermented foods. I remember my grandparents or my parents when they were canning and fermenting foods for the winter, and I never thought about the benefits of those foods. But it shows, and there are many studies that show that fermented foods, not only that they bring the fibers for our gut, but it also boosts the good microbiota. And, if you come from Europe, you know that wine, it has very beneficial effects. A glass of wine, not excessive alcohol use, will actually has good benefits for your health. And this is my favorite, the dark chocolate. You probably heard about the benefits of cocoa and the benefits of dark chocolate. If you are someone like me that crave for something sweet, you should take a bite of chocolate. There are many types of diets, and it's going to take us a couple of lectures to go through all of them. But I just wanted to mention a few of them, that they have good benefits for your health, and they also have, I would say, long-standing results. The Mediterranean diet, the intermittent fasting diet, and I'm one of those physicians that will encourage you to combine those things, or the new ITIS diet. And that's a type of diet that was recently published for patients with rheumatoid arthritis. It was basically mostly a plant-based diet with a lot of anti-inflammatory foods and herbs. But how to make those changes, how to incorporate those changes, because there are a lot of things that I already told you. You should consider to, basically bake those foods, or grill them, or you could actually steam them. I like, to be sincere with you, grilled vegetables, grilled fruits. You just sprinkle them with a little bit of salt, pepper, and a little bit of olive oil. You toss them on the grill for 5 minutes, and that's it. So it's very simple to do those. You should always consider a salad instead of a starchy meal. That will bring you a lot of fibers, and not only that, but will make you feel fuller the whole day, or most of the day. If you like fruits, you should eat them fresh. There's nothing better than a fresh fruit. But if you don't like to eat them fresh, you can put them in a smoothie. You can combine, let's say, celery or spinach in that smoothie. You can put chia seed in the smoothie, and it's going to bring you a lot of value for your nutrition. You can do twice a week. You can do a smoothie and replace the eggs and bacon, that classical eggs and bacon breakfast here in the United States. And that will also bring you a lot of energy, hydration, and also will bring you the nutrients that you need. So I would like to introduce you to a course that I designed, and I envisioned starting this course for a couple of years now. I put together everything, but in this course, I'm going to talk about everything that I know that is helpful for my patients, but it could be helpful for anybody in the world. This is a course that will incorporate nutrition, exercise, and mindfulness, and is specifically designed for people that suffer. I brought, people to help me. I believe in the value of collaboration with professionals, with people that have expertise. And together with me in this course, I have brought Dr. Melissa Curl, who is a physical therapist, a board-certified orthopedic specialist, and she's also a Pilates instructor. Melissa is also an Ehlers-Danlos patient. And if you heard about this, syndrome or disease, you know that being a patient with this disease makes you adapt, makes you understand better what you go through. So Melissa has designed exercises specifically for patients with pain caused by arthritis. She is an expert, and I value her presence in this course tremendously. And I also brought Elena Bradescu, who is a psychologist, psychotherapist, and psychodramatist. She is an expert in pain management. She knows a lot about mindfulness and how to implement that to manage your pain. And she's going to talk or introduce you to cognitive behavior therapy. This course will be designed to be over 8 weeks. It's going to be online, and it's going to have live session every week. People that will sign up to this will have lifelong access to all the lecture. And just to present you in a nutshell what we will talk about, it's going to be the mindset of, setting up, preparing for a nutrition plan, the foundation, the science, because everything that I recommend is based on science, and experience also. And then we'll lay out important things that you have to know about nutrition, how to plan and how to put into action those things. We're going to teach people how to manage their pain using mindfulness, how to sleep better, and Melissa will teach them how to exercise. She's actually going to have some live session to present you how to incorporate your exercise or exercises into your plan. In the last week, we will plan how to, make these changes to be sustainable. We will teach you how to plan your days. And I will offer you all the resources that I have used to build up this course. I have designed many things, from grocery lists to, plans. And, I hope that this course will will transform you, will help you feel better as you deserve to feel. I know it's New Year, and we said that we're going to have new resolutions, but I want to see your transformation. I enjoy seeing patients feeling better, and I enjoy seeing that they transform, they smile, they come back to my office, or they give me a call to say that they feel so much better. I have many stories that I will share over the course about patients of mine that experience this kind of transformation. And I hope that you're going to wake up and you're going to feel better, and you can enjoy the things that you like to do in your life, to travel, to go down and play with your kids, or just meet your friends. And with that, I would like to thank you for being part of this presentation.